Everyday emergency rooms see men arriving in crisis, chest pain, trouble breathing, or stroke symptoms that started hours or even days earlier. According to the CDC, men are 40% more likely than women to delay seeking medical care for urgent symptoms. Most waited, hoping symptoms would pass, not wanting to seem weak or make a fuss. One 52-year-old man, John, ignored chest pain for 2 days, thinking it was just heartburn. By the time he arrived at the ER, he was in full cardiac arrest. By the time they seek help, treatable problems have often become life-threatening. Studies show men are 50% more likely than women to die within a year of their first heart attack, largely due to delayed treatment. This isn't just stubbornness. It's a widespread issue rooted in culture and misunderstanding of strength. Dr. Michael Smith, a leading men's health expert, explains, "Many men are taught from a young age to tough it out, to see pain as a test of character. Men consistently show up sicker and later than women, leading to worse outcomes and shorter lives. In fact, men in the US live on average 5 years less than women, and late hospital arrival is a major factor. Early symptoms, persistent coughs, changes in bathroom habits, new moles, are dismissed or ignored. A 2022 survey found that 60% of men avoid going to the doctor, even when they suspect something is wrong. For many, seeing a doctor for anything less than a crisis feels like overreacting. Social stigma and fear of being perceived as weak keep men from seeking help. This wait-and-see approach turns preventable diseases into chronic or fatal conditions. Experts warn that early intervention could prevent up to 70% of premature deaths in men. The result, more strain on emergency services, higher costs, and unnecessary suffering for families. The financial burden of late care is estimated to cost billions annually. The real problem isn't lack of medical knowledge, but a broken connection between men and the healthcare system. Many men report feeling unwelcome or misunderstood in medical settings. Recognizing this pattern is the first step to saving lives. By breaking the silence and encouraging open conversations, we can help men get the care they need before it's too late. Around the world, men consistently live shorter, less healthy lives than women, often by 5 years or more. In countries like Russia, the gap can be as wide as 10 years, while in Japan and Australia, men still trail women by several years. Men lead in nearly all major causes of death, from heart disease and cancer to accidents and chronic liver disease. In the United States, for example, men are twice as likely to die from liver disease and 3 times more likely to die from suicide than women. This isn't just about biology. Experts point to behavior and social norms, like reluctance to seek preventive care or the stigma around admitting vulnerability, as major factors. In the UK, nearly 40% of men admit to delaying doctor visits, compared to just 25% of women. In the US, men are far less likely to have regular checkups or screenings. This pattern repeats in countries like Germany and South Africa, where men are significantly less likely to engage in preventive health care. The result? More hospitalizations for preventable conditions and higher death rates from suicide, alcohol-related diseases, and cancers detected too late. In Brazil, for instance, men are 70% more likely to die from preventable causes than women. Early detection saves lives, but men often delay until it's too late. Studies show that men diagnosed with cancer at later stages have survival rates up to 50% lower than those caught early. These patterns are consistent worldwide, from urban centers in the US to rural villages in India and Africa. Men's health is a global crisis, shaped by culture, access, and awareness. Acknowledging these disparities is crucial. Only by understanding the scope and causes can we begin to change outcomes for men everywhere. Mark, a 52-year-old construction manager, ignored months of abdominal pain and weight loss. He chalked it up to stress, long hours, and a tough work environment, just part of the job, he told himself. His wife pleaded with him to see a doctor, and even his teenage son noticed something was wrong. But Mark insisted he was fine, too busy, too tough, not wanting to seem weak or vulnerable in front of his family. As his symptoms worsened, Mark withdrew further, relying on painkillers and denial. He hid his discomfort, not wanting to burden anyone or admit he needed help. One night, Mark collapsed in his living room. His family watched in horror as paramedics rushed him to the ER. The diagnosis: stage 4 colorectal cancer, already spread to his liver and lymph nodes. The news shattered his family. Had he come in earlier, his prognosis would have been far better. Early detection could have meant a simple surgery, a chance at a cure, and years more with his family. Mark's story is tragically common. Men of all backgrounds, young, old, fathers, sons, avoid care until it's too late. This isn't ignorance, but a learned script: suppress pain, avoid vulnerability, and never admit weakness. These lessons are passed down, generation to generation. By the time help is finally sought, prevention is no longer an option. The window for early intervention has closed. Mark's case moved from manageable to terminal, leaving his family with regret, guilt, and unanswered questions. The emotional toll is immense, on spouses, children, and friends. This cycle repeats in countless families, across communities and cultures. Each story is unique, but the pain is universal. Changing the narrative around men's health is urgent. It means breaking the silence, sharing stories, and encouraging men to seek help before it's too late. From a young age, boys are taught to be tough, self-reliant, and stoic, values passed down through generations and reinforced by family, media, and peers. Phrases like "man up, don't cry," and "shake it off" become ingrained, equating help-seeking with weakness and vulnerability with failure. This armor of masculinity may protect egos, but it comes at a steep cost. Men learn to ignore pain, suppress emotions, and avoid showing any sign of struggle. Men often downplay symptoms. Back pain is just hard work, chest discomfort is probably nothing, and headaches are ignored until they become unbearable. Shortness of breath is dismissed as being out of shape, and persistent fatigue is chalked up to stress or age. Emotional struggles are hidden. Depression or anxiety is masked as anger, irritability, or substance abuse. Many men turn to alcohol or risky behaviors rather than admit they're struggling. The pressure to appear strong keeps men from seeking help, both physically and mentally. Studies show men are far less likely than women to visit a doctor, even when symptoms are serious. The very traits celebrated as masculine, endurance, silence, self-sacrifice, contribute to men dying younger from preventable diseases, accidents, and suicide. True strength means acknowledging vulnerability and prioritizing health. Real-life stories show that seeking help can save lives and inspire others to do the same. We must redefine masculinity to include the courage to ask for help, to talk openly about pain, and to support one another in seeking care. Only then can men break free from the dangerous tough-it-out mentality and live longer, healthier lives. The healthcare system often fails to engage men, not just in outreach, but in the very first moments they step into a clinic. Many men feel out of place, unsure of what to expect, or even how to navigate the process, from filling out forms to speaking with staff. Standard clinic hours and environments feel unwelcoming or impractical for many working men. Long waits, limited after-hours options, and rigid appointment systems create barriers that discourage men from seeking care. Health messages rarely speak to men's values, maintenance and optimization, not just well-being. Materials are often generic, filled with jargon, or fail to connect with men's everyday experiences and priorities. Men respond better to direct, goal-oriented language, like comparing screenings to car maintenance or using sports and performance analogies. When doctors use clear, relatable examples, men are more likely to understand and act on advice. Patient-doctor interactions can be rushed, filled with medical jargon, or even judgmental. Men may feel dismissed, embarrassed to ask questions, or reluctant to admit confusion, leading to misunderstandings and discouraging return visits. Solutions include flexible hours, telehealth, and male-friendly clinics that offer clear communication, respect privacy, and create a welcoming environment. Even small changes, like online booking or after-hours appointments, can make a big difference. Providers need training in male-specific communication, learning to listen without judgment, explain clearly, and build trust. Simple changes, like asking open-ended questions or checking for understanding, can help men feel heard and respected. The system must adapt to men, not the other way around. By addressing communication gaps, healthcare can become more accessible, effective, and welcoming for men, ultimately saving lives. Men face even greater stigma around mental health than physical illness. According to the CDC, nearly 1 in 10 men experience depression or anxiety, but less than half seek treatment. Many men describe feeling pressure to appear strong, leading them to hide their struggles. Depression and anxiety often show up as anger, irritability, or physical symptoms, rarely as sadness. For example, some men report chronic headaches, fatigue, or digestive issues, not realizing these can be signs of mental distress. These signs are frequently missed or misdiagnosed, leaving root causes untreated. Experts warn that men are less likely to discuss emotional pain, so doctors may overlook mental health issues during routine visits. Men die by suicide at much higher rates, nearly 4 times higher than women in the US. Many turn to alcohol or drugs to cope, which can worsen both mental and physical health. Personal stories reveal men often feel isolated, believing no one will understand. Integrating mental health screening into routine care is essential. Experts recommend that primary care visits include simple questions about mood, sleep, and stress, making it easier for men to open up. Normalizing conversations about mood and stress reduces stigma. When men see others sharing openly, whether in support groups or with family, they're more likely to seek help themselves. Accessible, male-friendly mental health resources can save lives. Online therapy, peer support groups, and confidential hotlines are making it easier for men to reach out. Addressing mental health is key to overall well-being. Studies show that men who seek help not only improve their mental health, but also lower their risk for heart disease, diabetes, and early death. Breaking the silence can truly save lives. When men finally seek help, it's often in the chaos of the ER, when symptoms can no longer be ignored and the situation has become critical. Emergencies mean higher costs, more invasive treatments, and worse outcomes. A single ER visit can cost thousands of dollars, especially if surgery or intensive care is needed. Heart attacks, strokes, and advanced cancers, these are often the result of conditions left unchecked for years. Early warning signs like high blood pressure or unusual pain are missed, leading to life-threatening emergencies that could have been prevented or managed with timely care. Delayed treatment leads to irreversible damage, like permanent heart or brain injury, and chronic health problems that require ongoing, expensive care. The emotional toll is heavy too. Men and their families face fear, uncertainty, and sometimes grief that could have been avoided. The ER can save lives, but it can't undo years of avoidance. Recovery is often longer and more difficult, and some damage can never be repaired. Each crisis visit is a missed opportunity for prevention. Instead of a simple checkup or early intervention, men face overwhelming medical bills, lost wages from missed work, and the stress of navigating a complex healthcare system. The system's failure to engage men early is costly for everyone. Hospitals and insurers bear the financial burden of emergency care, while families and communities lose fathers, brothers, and friends to preventable illness. Shifting focus to early engagement and routine care isn't just critical. It's a chance to save lives, reduce costs, and build healthier families and communities for the future. Blaming men isn't the answer. Systemic change is needed. This means looking beyond individual choices and addressing the structures that shape men's health outcomes. We must challenge outdated masculinity and redesign healthcare to fit men's lives. For example, workplaces can offer on-site health screenings and paid time off for medical appointments, making it easier for men to seek care without stigma or financial penalty. Community programs can promote a new narrative. Real strength is taking charge of your health. Initiatives like men's health clubs, Peer support groups and public campaigns can help normalize self-care and regular checkups. Start early. Teach boys that self-care is responsibility, not weakness. Schools can integrate health education that addresses both physical and mental well-being, while families can model healthy habits at home. Healthcare must offer flexible, male-friendly services like after-hours clinics, telehealth, and mobile health units, while integrating mental and physical care. Policy changes can support these innovations by funding community health centers and expanding insurance coverage for preventive services. Providers should use direct, trust-building communication and receive training to better understand men's unique health concerns. Building trust can encourage men to return for follow-up care and share important information. Families, employers, and communities all play a role in supporting men's health. Policymakers can help by funding public health campaigns, supporting research on men's health issues, and ensuring access to affordable care. With coordinated efforts across policy, healthcare, and community, we can help men live longer, healthier lives. The future of men's health depends on systemic solutions that empower every man to take charge of his well-being.